Let's start directly with my closing presentation. I will start with the first paper we talked about. So, targeting breast cancer stem cells using naturally occurring phytoestrogen was the first paper you sent me. It was my first time I do an extensive research like this one. I got invested in really in this topic, and I found very interesting information related to these naturally occurring compounds. So we talked about the different types of phytoestrogens and the different compounds and how they can work to treat cancer and specifically cancer stem cells. And from this paper, we focused more on immunotherapy and specifically breast cancer and cancer stem cells in general. So the second paper was 1 minute. Okay, can you see my
Yes.
screen? Okay, so the second paper was about breast cancer stem cell antigens as targets for immunotherapy. So here you told me to go and find some articles specifically about immunotherapy and some antigens that can be targeted on breast cancer specifically. So we found that targeting cancer stem cells with innovative immunotherapy is of utmost importance to the goal of curing cancer from its roots. And to achieve tumor eradication, the ideal vaccination targets are those present on differentiated cancer cells and overexpressed in cancer stem cells. And I gave you some examples about the different antigens that can be found on cancer stem cells and not on normal stem cell tissues. And after finishing with this paper review, we talked about a case report. If you remember, I did this small scheme about the treatment, about the course of treatment given to the patient, where they implemented her treatment with an immunotherapy, a drug called camrelizumab or pembrolizumab, and an anti-PD-1, which is an immune checkpoint inhibitor and is used to treat cancer stem cells. So we saw that after this course of treatment with 2 weeks of chemotherapy and 2 weeks of other drugs and finally with surgery, this patient was in complete remission. So we concluded that immunotherapy can be very important to implement traditional therapies like chemotherapy and surgery. Then we specifically talked about CTLA-4, which is also an immune checkpoint, an immune checkpoint like PD-1. It is an extensively researched antigen and have proven to treat cancer stem cells, specifically breast cancer. We know that CTLA-4 checkpoint is used to avoid uncontrolled immune responses and prevent autoimmune reactions, and that CTLA-4 plus regulatory T cells expression in the blood of breast cancer patients was 7 times higher when compared with healthy patients. So we also concluded that this CTLA-4 was actually used in clinical immunotherapy and proved some success treating breast cancer. And then the final paper was a potential target for cancer stem cells for immunotherapy. I chose crypto1, which we talked about in our second paper, I think. I chose crypto1 to be to talk about, and I understood from the paper I read and other research I did that the need to attack new targets for immunotherapy came into play in view of the fact that no immunotherapeutic target has been found that retains validity in the face of tumor diversity. So a lot of research was done recently on different new potential targets, and one of them was crypto1. So this target is a unique co-receptor required for nodal activity, which plays an important role in enhancing tumor growth and metastasis. So I think it's a good research topic or a good antigen to start working on it more extensively, along with other potential targets, of course. And from there, you told me to prepare my paper review, my article about cancer stem cells. I read a lot about this topic and this hypothesis, and I knew that this model was advanced into the medical field a long time ago, but not until the recent years they did some really good advancements and research on this topic. So yes, we basically I did this simple article, like you said. It's not very technical. I think everyone who will read it will understand the concept of cancer stem cells, which is a really important topic for future research to eradicate cancer from its roots. And finally, what I learned from my internship with this a beautiful organization is that modesty and perseverance are wait, I can't. Okay, there's something wrong. I wrote here modesty and perseverance. I think modesty and perseverance are two important characteristics that Dr. Jacinto Convid had taught us, and every healthcare worker and physicians and everyone who work in this field need to have these two characteristics to really succeed in his work.